HIV AIDS Act, 2017 General Studies 2 in News. Announcement of implementation of the Human Immunodeficiency Virus HIV and Acquired Immune Deficiency Syndrome AIDS Act. The Act, which received presidential assent on April 28 last year, prohibits discrimination against such persons in accessing health care, getting jobs, renting accommodation, admission and educational institutions. Whether private or public, India is the first state in South Asia to pass legislation prohibiting discrimination by the Ministry of Health. Status of the Act. The Act received presidential assent way back in 2017, but it was not notified. The current development has come after the Delhi High Court asked the center why it has not yet notified the law to prevent discrimination against HIV and AIDS patients, despite the statute receiving presidential assent in April last year. Key statistics. India has the third largest HIV-infected population with an estimated 2 million people. The country aims to decrease new infections by 75% between 2010 and 2020 and eliminate AIDS by 2030. India brought down the number of new cases and deaths by 27% and 56%, respectively, between 2010 and 2017. But even as India celebrates such progress, it is important to be mindful of the scale of the challenge. With 2.1 million cases, India is among the largest burden countries in the world. And there are critical gaps in its strategy. What is AIDS? Acquired Immune Deficiency Syndrome. AIDS is a condition caused by human immunodeficiency virus HIV, which attacks and weakens the body's immune system. The objective of the Act: prevention and control of the spread of the HIV/AIDS. Mandates the central government with respect to also the state governments to formulate rules and also to have laboratories in place for assisting all those people who have been suffering with HIV/AIDS. Protection of the basic human rights of the people suffering from HIV/AIDS. The Act penalizes discrimination against protected persons and lays down provisions for guardianship of affected minors. Salient features of the Act. The Act penalizes propagation of hatred against the protected person, where a violator could be punished with a minimum jail term of 3 months to a maximum of 2 years and can be fined up to 1 lakh rupees. As per the Act, union and state governments shall take measures to prevent the spread of HIV or AIDS, provide antiretroviral therapy and infection management for persons with HIV or AIDS, facilitate their access to welfare schemes, especially for women and children, among others. The government will also issue necessary guidelines with respect to protocols for HIV and AIDS-related diagnostic facilities. Antiretroviral therapy and opportunistic infection management will also be applicable to all persons. The Act makes antiretroviral treatment a legal right for all HIV/AIDS patients. It has also adopted test and treat policy, which means any person testing positive will be entitled for free treatment by the state and central government. Earlier, this was restricted by a CD for count rate. Provides for confidentiality of HIV-related information and makes it necessary to get informed consent for undertaking HIV tests, medical treatment, and research. The law makes it mandatory for state governments to appoint an ombudsman to inquire into complaints related to the violation of the Act and the provision of healthcare services. If a person or an institution fails to comply with any order given by the ombudsman within a stipulated period of time, they could be fined the maximum of Rs 10,000. A continuous failure could lead to an additional fine of up to Rs 5,000 every day until they comply. The new legislation has provisions to safeguard the property rights of HIV-positive people. Every HIV-infected person below the age of 18 years has the right to reside in a shared household and enjoy the facilities of the household. The way ahead. No one should be left behind in the fight against HIV. There is an urgent need to tackle the social stigma surrounding people suffering from AIDS. Activists from the HIV community had demanded changes to the Section 14(1) of the bill, which states, the measures to be taken by the central or state governments under Section 13 shall include measures for providing, as far as possible, antiretroviral therapy and opportunistic management to people living with HIV or AIDS. The HIV community and other critics demanded that the phrase "as far as possible" be removed from the bill, as it can be used as an escape route by the state governments which do not want to fulfill their responsibility. Important value addition: HIV/AIDS. First disease to be the subject of the UNFC Resolution 3. Northeastern states emerge as new HIV hotspots. Methylatum, Mizoram and Tripurate. Reasons being attributed to injecting drug users and unsafe sexual practices. The HIV fentanyl surveillance HSS, a biennial study conducted by the National AIDS Control Organization (NACO), is one of the largest regular studies in the world dealing with HIV in high-risk groups of the population. Antiretroviral treatment leads to effectively suppressing the virus and reducing the transmission of HIV from the infected person. National AIDS Research Institute (NARI) target is to bring 90% of the 21 lakh people living with the HIV infection in India under ART. What is HIV and how is it a life-threatening disease? How has India battled against HIV? Critically examine